Ischemic stroke is one of the most common causes of morbidity and mortality in the United States. This year alone, it is expected to affect nearly 700,000 Americans. A common but often overlooked sequela of stroke is depression. Approximately 1/3 of stroke survivors will go on to develop post-stroke depression, based on studies. However, less than 5% are actually recognized in general practice. Depression in this population is linked to lower quality of life, impaired recovery, increased risk of recurrence, as well as an overall increase in mortality. The site of interest is an outpatient stroke clinic in North Florida that oversees the care of more than 1,000 patients diagnosed with stroke as part of their hospital discharge and follow-up each year. There is currently no consistent use of a formal depression screen in the clinic, despite American Stroke Association guidelines calling for screening since 2010. This project details a plan to enact routine depression screening for patients seen in an outpatient stroke clinic as part of their hospital follow-up. The Iowa Model Revised, evidence-based practice to promote excellence in healthcare, will be used as the guiding framework for project implementation. To address barriers to screening, including identifying a screening tool that has both acceptable psychometric properties for the population and high feasibility. In addition, barriers to address provider awareness through education and a plan for implementation that is sensitive to office efficiency are also utilized. Per the Iowa model, the team at the clinic, led by the DNP student, has decided to move forward with a 6-week pilot screening patients with a PHQ-9. All participation is voluntary. Demographic information of the patients screened in the pilot will be compared to patients from the same 6-week time period from the previous year to evaluate for an increase in need for further evaluation of depression as well as for homogeneity. Provider awareness will also be evaluated before the educational module, after the educational module, and following the 6-week pilot via the Qualtrics survey platform.